are on our way to live in YouTube.
Okay, let's go.
Thank you.
You're muted.
Yeah, still muted. Yes, we are waiting for Professor Sarah, and we also now have Professor Umi with us as the Dean of the Faculty. Bu Dewi is still muted.
Yeah. Okay.
Hello.
Yes, this Prof. Umi, our dean.
Hello, Dr. Nurul.
Hello.
Hello, Raju.
Assalamualaikum, Dr. Umi.
Waalaikumsalam.
How are you?
Hi.
Nice to see you.
Nice to see you.
Even though it's far away, but this is the future. Seeing each other from the computer.
How about COVID at Brunei, Dr. Nurul?
How is what? COVID situation, Alhamdulillah. There's no reported cases so far. Only 3 people are in treatment. So because we close our border, so these are only imported cases.
Because the people is small people.
Small country as well. Yeah, it's different, yeah, from your big country with the millions of population. We only have 500,000. Not yet millions. But also chaotic in the beginning because it's the first time we deal with such a situation. I mean, I remember SARS, but it does not affect Brunei, H1N1 and MERS-CoV, but it doesn't really affect Brunei so much. But with COVID, everything is like upside down.
When you come to Indonesia again.
Allah, yeah, if there's trouble, it's a
Hello, good afternoon, Sarah. How are you?
Hi. Good, thank you. How are
Okay,
you?
fine. I am good, thank you. It's very glad to meet you.
How?
Okay. So is everything okay?
Everyone is also is already on board, isn't it?
Yep.
Yeah, we have Professor Sarah, Dr. Dewi, Dr. Ragu. Wabarakatuh. Hello everyone and welcome to today's session. A warm greeting from Surabaya, Indonesia, and thank you for joining us for today's webinar. This webinar is live streamed in the YouTube channel of the Faculty of Pharmacy, Universitas Airlangga, and is broadcasted using our Zoom platform. Now, we currently have 1,000 participants attending the Zoom platform and more viewers in our YouTube channel. My name is Andi Hermansyah, and I'm from Faculty of Pharmacy, Universitas Airlangga, and I'll be responsible for moderating this webinar today. This webinar is hosted by the Faculty of Pharmacy, Universitas Airlangga, Indonesia, in part of celebration of the 57th anniversary of the faculty. Now, first of all, allow me to acknowledge the tireless effort of our pharmacists to help saving the nations and our people in the battle against the COVID-19. Now, today we are presenting an interesting and intriguing topic on managing global partnership in the COVID-19 era, teaching, learning, research, and partnership. A bit of introduction. So pharmacy schools and colleges worldwide are facing unprecedented challenges to ensuring sustainable education during the novel coronavirus or COVID-19 pandemic. Now, personally and professionally, pharmacy educators worldwide have cycled through a period of stress, then resilience, fear, then relief, and pessimism to become hope. This situation, which has been ongoing within the past 7 months, require educators to approach work differently. Now, because of COVID-19, many universities and schools of pharmacy have transitioned to emergency remote delivery of courses that is mostly online and with no face-to-face interactions. We all aware that these were not always easy conversations, and this has also happened to our research environment as well. Laboratory research, clinical and community project must be conducted under strict protocol which may restrict researchers' access to the data sources. Now, it is likely that when the COVID-19 crisis abates, pharmacy education and healthcare will be forever altered. This is the rationale why this webinar is important. Academic leaders, instructors, and students will be changed, and therefore we need to understand how we have dealt with the pandemic situation. Learning from our reflection and knowing other people's experiences might provide an insight for our journey together during and after this pandemic era. Now, just a little housekeeping before we get started. This is the schedule of today's webinar. First is the opening remarks from our dean, and then we will have two sessions for this webinar. We will have an outstanding list of attending speakers. The first speaker, Professor Sarah Herbert Thompson, and second speaker, Dr. Nuralaini Kifli, and also the third speaker, Dr. Raghu Radhakrishnan. And then the remaining speakers will talk on the second sessions, Dr. Fazrin Asmi and also Dr. Debbie Melanie Haryadi. And now for the first program, I would like to invite the Dean of the Faculty of Pharmacy, Universitas Airlangga, to deliver her speech. Please welcome Professor Dr. Apotheker Umi Atiyah.
Thank you, Mr. Moderator. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Dear our distinguished speakers from 5 countries, first, Professor Sarah Robert Thompson from Australia, Dr. Nuralaini Kifli from Brunei Darussalam, Dr. Fazrin Azmi from Malaysia, Dr. Raghu Radhakrishnan from India, and to Devi Melanie Haryadi, PhD from Indonesia. Ladies and gentlemen, welcome to Surabaya for all distinguished speakers and participants, although virtually, in the webinar series of Faculty of Pharmacy, Universitas Airlangga, with the title Managing Global Partnership in the COVID-19 Era, Teaching, Learning, Research, and Partnership. This international webinar is a part of our 57 years of faculty's anniversary this year in 2020. We would like to thank you for your coming to be ours in this pandemic era. I suppose this COVID-19 pandemic era is still happening in your country. We hope this continuous networking can be sustained to strengthen and hand in hand to fight against the virus and continue our ongoing collaboration. As we know, it is very obvious in the time of COVID-19 pandemic, all higher education in the world were suffered from it. Only collaboration and partnership beside innovation are indispensable for our response to and recovery from this crisis. Sharing our best practice each other around the world from different universities is the best way to solve some global issues, especially in pharmacy education and for improvement of global mobility program. This international webinar held by Faculty of Pharmacy, Universitas Airlangga is also aiming to strengthen collaboration between all networks by promoting the new or recent adaptive activities in the area of teaching, learning, research, and partnership. Ladies and gentlemen, I would like also to extend my deeply appreciation to the organizing committee for all effort in making this as a successful event. Finally, let me start to open this webinar. Webinar Managing Global Partnership in the COVID-19 Era, Teaching, Learning, Research, and Partnership is officially open. I wish all of you will gain many advantages from this event. Enjoy the webinar. Thank you Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. Thank you very much, Prof. Umi, for your speech. Ladies and gentlemen, before we started our webinar, we need to have a photo session first. Please turn on your videos and then let the organizing committee to record and take your photos. I still see some people are not turning on their videos, please. Okay, let's start in a normal pose. In 1, 2, 3. And now the uncommon pose, please. Professor Sarah, do you have any recommended pose for this one? Like this one or this one? We used to have this one. Okay, come on. This is a very motivated, sir. Come on, this one. Okay, perfect. Yes. And 1, 2, 3. Good, thank you. And other pose, probably. Dr. Agu, like this one. Okay, that's lovely. We have this one. Okay. Thank you very much. And 1, 2, 3. Thank you very much. Thank you very much for all your participants in this photo session. Now, before we go further to the next program, please be aware that in order to obtain e-certificate, participants need to fill out attendance lists. And then you need to be online as well during this webinar, and you need to fill out the post-test questions at the link, which is currently displayed on your screen. And then, of course, we'd love to hear from you. You will have the opportunity to submit text questions to today's presenter by typing your questions into the question pane or chat box in your Zoom or YouTube control panel. So you may send in your questions at any time during the presentations, and we will collect these and address them during the Q&A sessions at the end of the presentations. Now, for the first speaker, I'm pleased to introduce the distinguished Professor Sarah Robert Thompson, who is also the head of School of Pharmacy at the University of Queensland, Australia. How are you, Professor Sarah?
Thank you. Thank you very much.
Yes, so this is her CV. Her research interests particularly focuses on the breast cancer and calcium signaling within the breast cell. And she has also received award, the UQ Research Supervision Excellence Award in 2007, and also Principal Fellow of the UK Higher Education Academy in 2017. She is currently the head or the dean of the School of Pharmacy, started in 2020 until when? It's 5-year periods or 4-year periods?
Yeah, 5 years.
5-year periods. And then she also involved as the consular of the Australian Pharmacy Council, starts in 2020, and also non-executive director of the UQ Healthcare and of International Education Limited. Now, without further ado, we will turn the time over to Professor Sarah. Please, Professor Sarah.
Okay, thank you, everybody. I will just share my screen. Excellent. I think, can you see that screen now? Yes, excellent. Thank you. First, may I say hello to everyone and say thank you and what an honour it is to be asked to present in this particular seminar. I think that you have done a wonderful job in getting people together, and congratulations also on the 57th anniversary of your faculty. That is a wonderful achievement. So I'm going to talk a little bit about how we're handling the COVID-19 pandemic here in Australia, and I'm so very interested to hear how everybody else is also handling it. But let me give you a little bit of background first. Well, actually, first, I'd just like to acknowledge the traditional owners of our country, and particularly where I am standing right at this very moment, and pay my respects to their ancestors and their descendants. So this is me, as I was just introduced. I am a pharmacist with a PhD, and I have worked in community and hospital pharmacy, but I've been an academic since 1998, and I have a large lab on breast cancer research and calcium signalling. My teaching areas have mainly been all on drug discovery and cancer. And over the last 10 years or so, I have had a variety of administrative roles, including involvement in higher degree research or PhD education as the Deputy Dean of the Graduate School. I've spent the last 8 years as the Associate Dean Academic with strategic oversight across teaching and learning across all of allied health, not just pharmacy. And as I was introduced, I have just recently taken up the role of Head of School of Pharmacy. So I've come back to my discipline, which is I'm enjoying very much. On the right-hand side, you can just see a couple of pictures of my lab, my PhD students, research assistants, and postdocs. So I thought I'd start by showing you where we are, just in case you don't know. So the University of Queensland, where I am right now, is in the state of Queensland. So that's one of our states here on this map here. And we're actually in Brisbane. Now, I'll come back to this, but it's important for me to point out to you that we have another state right down the bottom of Australia called Victoria, and I'll mention that in a little moment. But let me tell you about Queensland. We're actually subtropical. We have a lot of sunshine. We have a beautiful place for our city, which is divided actually by a river, and we have the north and south of the river. And the next slide will actually show you our St. Lucia campus. So here's our city off in the distance, and the St. Lucia campus, which is just around here, this whole peninsula, is about 5 kilometres from the city. And it really is very beautiful, surrounded by that river. And the university across, there's a bridge here. This bridge is what we call a green bridge, which means that there's no cars, there's only buses and people allowed on it. And part of the university is across this bridge, and that's actually where I am standing, and I'm giving this webinar from on this other side of this green bridge. And that's where our School of Pharmacy is located, adjacent to one of our large teaching hospitals. Now, the University of Queensland is one of the top 100 universities across all of the major rankings for universities. And within our faculty, pharmacy and pharmacology is ranked number 31 in the world. So we're very proud of where we are situated in the world and what goes up to make that about our research and our teaching. So our School of Pharmacy is located in these beautiful purpose-built buildings, the Pharmacy Australia Centre of Excellence. It's under 10 years old, and it cost about $100 million when it was built. So our pharmacy students and students in our other programs learn in this beautiful environment. Now, I thought I'd just start by saying that the University of Queensland does a lot of engagement with Indonesia, and we actually have an office that was established in 2014 and a staff member who works in Indonesia and looks after our agreements and our relationships with government and also with universities. You can see here that we've had a number of Indonesian students enrolled at UQ, and therefore we have a number of alumni in Indonesia. And we actually have a new Vice-Chancellor who only started a few weeks ago, who has told us only a few weeks ago in a meeting with the heads of schools that Indonesia was one of the countries that she wanted to have closer ties with. So this is a really opportune moment for us to make this connection. So on to what I'm going to talk about today. So coronavirus, it's all we hear about, isn't it? So this is the BBC data. I thought I'd give you a bit of a snapshot of your country compared to our country and compared to a country that perhaps isn't handling the coronavirus pandemic as well as others. So here in Australia, we've had 762 deaths and our death rate is around 3.1. Our total cases are only around 26,000. And that's in comparison to yours, which is around the same. But of course, the US has had a much higher death rate, much higher number of cases. And it is worth putting into perspective that Australian population is only 25.5 million. And of course, for you in Indonesia, you have 273 million. Now, let me tell you a little bit about the response Australia has had to COVID-19 as I explain what we've done here in the university. But before I get to that, let me just tell you what's happened here. So you may know that we closed our international borders in about March, and up until then we're still allowing our own residents to come back to Australia. And we have a situation whereby each of our states that make up Australia has very different approaches to or strategies to the coronavirus. This is us in Queensland, and the most of our cases here in Queensland are actually coming from people that are coming back into Australia. And what happens is when they come into Australia, they have to go into 2 weeks quarantine in one of our hotels. So all of our hotels no longer have tourists, but have our people coming back to Australia. And so they're in quarantine and are quite protected and looked after if they get coronavirus. What has happened in that state right down the bottom of Australia in Victoria is that they've had a second wave, and the majority of their infections at the moment are through community transfer. So we have a very different situation occurring in each of our different areas of Australia because we have state governments as well as our federal government. And you may know that in March, this is the Prime Minister's media release, he made Australia close all of its borders to all non-citizens and all non-residents. And that's still in place at the moment. And of course, that affects our ability to have international students come into Australia. And that has hit us in the tertiary sector quite hard. So I thought I'd start with a wide view of the University of Queensland and what the university, the global university, not just pharmacy, did when semester one started. And if we go back to January, if we can all remember back that far, that was when at least we started to hear about the virus coming out of China. And in Australia, we restricted Chinese or people that had gone through China from coming into Australia. So when we started in January, after Christmas time, we came back and we were trying to work out how to teach our students who'd come to start their semester in February. We knew that some of our students weren't going to make it to Australia. And we knew that we thought at this time that they would come to us in about week 5, that everything would be over by February. And so we started to think in January about how we could teach those few students from China who couldn't get to Australia, how we could teach them online. Well, as we know, things turned out to be a little different to that. And by February, we were having all of our borders closed to international students. So suddenly we were faced with many of our students that now could not come to Australia, could not be here on our campus. By the 23rd of February, we had our first case of COVID-19. It was actually in my faculty in one of our big cohorts of students. And it's about that time that people started to realise that things were definitely getting worse. And by March, when the Prime Minister closed our borders, we were at the point where we knew that we had to take all of our teaching online and that we couldn't be in at the campus with face-to-face teaching. So the university took the approach of stopping everything for a week. Have a break. And the academics stayed here at the university and thought about how they could move all of their teaching online, how they could deliver all of their practical classes, which we do in pharmacy all the time in laboratories, how we could even present them when indeed we couldn't have our students here. And I'll show you some examples of that in a moment. Now, we also thought that, this would be over by the end of first semester. And so we put an extra 2 weeks at the end of the semester where we thought everybody would be back here at campus and we'd allow them to catch up in our laboratory. So anything they'd missed, they could come in and do it in an intensive form. Well, as you know, that wasn't what has worked out. So by July, we realised semester 2 was also going to be online, and we have a hybrid situation I'll explain in a moment. And now we're making plans for semester 1 next year. The university itself also realised a lot of our students had a lot of hardships. They'd lost their part-time jobs. A lot of them didn't have computing equipment. They didn't have the Wi-Fi networks. And so the university put in place systems to help our students and started to allow our students to come onto the campus as long as they were socially distant so that they could log into the Wi-Fi, for example. The university has put a lot of resources into the health and wellbeing and also academic support of our students. So what about us in the School of Pharmacy? Well, very briefly, we have a number of different teaching programs. So we have our Bachelor of Pharmacy, which is our 4-year undergraduate program. We also have a 1-year intern training program, which is where once our students graduate from their Bachelor of Pharmacy, before they become a registered pharmacist, they work clinically and they come and do some training with us. We have a Masters of Clinical Pharmacy, which is a 1-year specialty program for pharmacists who have been in the workforce for a few years. And then we have a very new program, which I'll tell you a bit about later, our Masters of Pharmaceutical Industry Practice, which is a 2-year master's program and a graduate certificate as well. Now, if I take away the Masters of Clinical Pharmacy, all of these programs have face-to-face components. And if I just have the Masters of Clinical Pharmacy, that program's actually a completely online program. So the academics teaching into that particular program, there was no difference for them. In fact, we could use what they had learned over many years in our other teaching. So these are the stages we went through, and I'm sure many of you have gone through this as well. The first was right at the beginning of the semester when we had to redesign our courses, putting some material online to accommodate those students who we thought would be arriving from China by week 5, and then we'd allow them to catch up. Then, of course, by March, we realized that wasn't going to happen, and we had to move to completely online delivery for all face-to-face material. But we were able to continue our clinical placements. Our community pharmacies and our hospitals have all stayed open, as no doubt they have in your country as well. Our academics used lectures they had recorded the year before, and we gave all of our tutorials using Zoom. So that was semester 1, the first half of the year. As we moved into semester 2, Australia has quite successfully put in place contingencies and strategies for ensuring that the COVID-19 virus is kept at bay. And so we now have a hybrid situation where we can actually have critical learning activities face-to-face under COVID-safe conditions, and I'll explain that in a moment, but we still deliver online for any students that can't attend the campus, and all our lectures are online. So our lectures are online, it's only our tutorials and our wet laboratory practical classes that we can have face-to-face. And also we have to consider not only our international students that haven't been able to get here, but some of our students have gone home to other parts of Australia. And for example, here in Queensland, our borders are closed. No one from south in Australia can actually come into Queensland, just like they can't come into Australia. So if we had somebody who was living in Sydney, they might not have been able to get to Brisbane. And there's also students who might be sick, and we try to ask them not to come into the campus, of course. So our academics are actually doing what we call parallel or dual mode teaching, and that is really tiring for them. So they're having to teach both online and face-to-face. So they're doubling up all of the time. So it is an incredible workload for our academics, and it's also taking them away from their research time. So this is our conditions for COVID safety, and this is across Australia, even though this is a UQ slide. We're being asked to stay at home if you're unwell at all, cover your nose and mouth when you sneeze or cough, avoid touching your face, wash your hands all the time. It's becoming quite a habit now. Clean your surfaces. The main one which is causing us to change things in teaching is that we must maintain 1.5 metres between each other. What that means is if we had a classroom that used to hold 30 people, it might now only hold 18 people because we can't fit as many people in there, which means that our academics are having to repeat tutorials more often than they would have before. So again, adding to their workload. So what have we done in our teaching space? Well, very quickly, when we went online for our Bachelor of Pharmacy, we had the Zoom lectures and tutorials. We also got each of our professors and academics to give weekly question and answer sessions so that the students felt connected, because one of the main things that we came back from the students is that they didn't feel connected and they were losing motivation. And so being able to just log in and chat to an academic at any time seemed to be a way that we could help this. We also have virtual practicals for students to learn things like compounding and counselling all online. But as I said, our placements still went on. This just gives you an example. This is a video that's uploaded to one of our websites, and it was actually showing how to mix. It was one of the practical classes, and so during that pause week, the academics got into the labs and they actually videoed themselves doing all of these things so they could put it up online. And here's one of our academics who's actually in the middle of a practice counselling session with a group of students, and that's on Zoom. Another one of our academics put together a virtual dispensary. I think this particular academic has been really clever. He's put together all of the things that would normally be on a shelf in our simulation of a pharmacy, and the student can pick any of these items and then they can click on them and up comes the information from that package as if they've turned it around and read all of the bits on the actual package. Could assist the students. And then also, of course, the whole issue of how do we examine online. And one of our academics shown up there in the corner, Peter Moyle, he did a lot of work on putting oral exams online and making sure that there was integrity around the exam process. So moving on, that's our undergraduate. This is our postgraduate, our Masters of Pharmaceutical Industry Practice, and it was basically exactly the same. We had drop-in sessions, but they had more drop-in sessions. These students are mainly international. Some of them were stuck here in Australia without their families, and it was very important for us to make sure that we maintained connection with them, ensured they were okay. Question and answers with the professor, Zoom lectures, including those from, we actually had an academic Zoom in from the USA, oral presentations on Zoom. This is another example of a virtual prac. So this is in the bottom right-hand corner. It's actually one of my PhD students. And she went into the lab and demonstrated one of the pracs. And here's the academic in the top who is actually saying what's happening. And then on the left-hand side, it's the same academic doing a question and answer series online. And I just thought I'd give you an idea. This is one of our wet labs in our building, and the students usually are really closely packed in here. There's usually about 6 of them in each of these bays. But as you can see, there are very few students. This next photo shows that even more. And that's because of that 1.5 metre distancing. So to get the same number of students through, there obviously has to be a number of rotations. And as I said, this is, I really do believe that this is a lot of work for our academics who are doing a marvellous job. Now, research, what have we done in research? Well, a similar thing happened in research. We started off with a lot of our, we thought it was all okay, and then suddenly we had to go and work from home. And so a lot of our research closed down. For example, in my laboratory, 3 of my students actually, who are pharmacists, actually went back to work as pharmacists to help in the surge health workforce. And so they interrupted their PhD studies. And a lot of our students did that because they are pharmacists. And so they went back to help in the industry. And then, of course, we had to close down all of our face-to-face human research. But as we started to move along, we started to bring things back, and we're doing them in that COVID-safe manner. So making sure that there is distance between people. Now, you probably, or you might know here at the University of Queensland that we actually led the discovery of the cervical cancer vaccine. Professor Ian Fraser, who's shown there in the right, and his collaborator. So they actually developed a vaccine that protects women and girls from cervical cancer. That's the Gardasil vaccine. And it was met by President Barack Obama when he visited the University of Queensland. Have a research team that has been chosen as one of 3 organisations to develop a vaccine against the novel coronavirus. And it is one of the front runners in the vaccine, developing of vaccines at the moment. It uses a very novel technology. It's not attenuated virus, it's not adenovirus. It uses a clamp patch technology, which is very different. And so this slide is slightly out of date. They're now in phase 3 trials. And so we are very, very hopeful that these will help the world in terms of having a vaccine for COVID-19. But they're not the only ones in doing research on COVID-19. So we also have some Australian researchers here at the University of Queensland that are looking at repurposing existing drugs to see if they have the potential for coronavirus treatment. And this is another study which was just released, which is looking at intensive care unit data and using that to guide COVID-19 treatments. So there are a lot of our researchers are on the front line in looking for solutions to this COVID-19 pandemic. And then I'll move into global partnerships. Of course, this has been a bit harder, but this is a wonderful opportunity that we've got here to cement global partnerships. And I guess as we've moved from everyone sort of rushing to work out how to put things online, how to keep our research going, I think now our attention is moving towards re-strengthening and recreating those global partnerships. And so most recently, our Deputy Vice Chancellor External Engagement actually sent out a memo saying that they are going to put seed funding into strategic institutional engagement between UQ and strategic global partners, and it can be for things like virtual webinars or virtual conferences. And so that's the direction and the thoughts that are now occurring in our university as we start to understand the situation a little better. I just want to end by giving you a little bit more detail of the programs we have, because I'm sure that they are of interest and they mirror some of the programs that you have at your university as well, just to show how aligned we are. So we have a Bachelor of Pharmacy, which is our undergraduate program, which creates registered pharmacists. It's a 4-year program. We also have an entry not just into semester 1, but also semester 2 now. It's a bit longer, but we're working on getting it shorter. So that's our Bachelor of Pharmacy. And we also have opportunities to do some specific research projects in the latter years of their program. And we have a lot of our students come back and do PhDs after they have done this particular research project. We're also very excited because we are the largest deliverer of allied health programs in Australia within our faculty. We can get all of our students together. And of course, I'm sure you're all aware of interprofessional education, where we get our colleagues to all work together to have better health outcomes. So our pharmacy students get to study with 14 other health professionals. In their second semester here, in the beginning of their program, so in first year, they actually do a course all together, and they get to understand what each different profession actually does and can add to the team. And of course, our students have placements, over 300 hours of placements, and we have over 500 placement organisations in urban, rural Australia and overseas. So overseas at the moment isn't working for us, but our students are still going out into rural and also within Southeast Queensland. So a program that we started only a year ago, and it's only had 2 cohorts, is our Master of Pharmaceutical Industry Practice, and it has been very successful. These are for students that have a science background, may even be pharmacists, but want to move into the pharmaceutical industry. So often students who are doing other coursework masters, but are also interested in into the pharmaceutical industry, maybe they're not so much interested in PhD study or biomedical research. And it's really all about getting students to understand the process in the pharmaceutical industry. So it's a 2-year full-time program. In year 1, they have courses which cover product registration process from discovery right through to formulation to post-registration surveillance. It's delivered here where I'm standing at the moment at the PACE, at Pharmacy Australia Centre of Excellence, but we have many people from industry contributing, and we have a lot of industry around us. Then in year 2, our students can either have an opportunity to do a long placement with industry, or they can do a research course, or they can just do some other courses which can lead into some more management areas. And this program can start in February, July, and we also have a graduate certificate, which is a smaller part. And we have bursaries on offer for students who might be interested, and we'll definitely send you some information later. So the program focuses on communication, leadership, project management skills, which are all required for a successful pharmaceutical industry career. And all of our programs across a school are supported by student and academic mentors and a comprehensive suite of programs to support students to settle and integrate into our UQ student life. And that's all I have to say. Thank you. And I look forward to answering your questions at the appropriate time. And again, thank you very much for the honour of presenting in this particular symposium. And I will stop sharing now. There you go. Have I done that? Yes.
Yes. Thank you very much then, Professor Sarah. I hope all of you enjoy her amazing presentations, and then don't forget to apply for the scholarship as well to the UQ as well for the Master of Pharmaceutical Industries. Okay. Now, for the second speaker, we will have Dr. Nuraini Kifli. Dr. Nurolaini Kifli, or I often mention her as Dr. Nurul. She is the Senior Assistant Professor at Pangeran Anak Rashidah Saadatul Polkiah Institute of Health Sciences at the University Brunei Darussalam in Brunei. Next slide. So she has a rooted interest in the medical and or pharmacy educations, traditional herbal medicines, and also natural product isolation and its biological evaluation to cervical and lung cancer survival rates. She started her careers as pharmacy program leader, the head of pharmacy program leader from 2018 up to now. And then she also the herbal research lead for the University Brunei Darussalam since 2018. She is currently the member of the Royal Pharmaceutical Society of Great Britain or UK, and also member of National Board of Pharmacy in Brunei since 2014. Apa kabarnya Dr. Nurul? How are you?
Fine, thank you. Thank you, Dr. Andi, for the kind introduction.
Thank you very much. Please, the stage is yours.
Okay, let me share my slide. Current. Yeah. Can you see that clearly?
Clear and clear.
Okay, thank you very much. Greetings from Brunei Darussalam and a very good afternoon to everyone. Thank you, Dr. Andi, once again for the introduction, and thank you, Universitas Erlangga, for inviting me and also organizing such a international webinar at this time of the year. And I'm very honored to be invited to be one of the speakers. And I would also like to congratulate for your 57th anniversary for your School of Faculty of Pharmacy. Correct me if I'm wrong. And well done. That's quite a journey. And we just started, by the way. Right. So the title of my presentation, I'll be just concentrating on the pharmacy area, so managing global partnership for pharmacy students during the COVID-19 era at University Brunei Darussalam. So that's what our university name is, University Brunei Darussalam. Just a brief introduction. I'm the program leader for the pharmacy program at this institute. There's other program available as well in this institute, such as medicine, dentistry, nursing midwifery, and also biomedical sciences. Right, so the overview, I'll be talking, as you all know, just briefly about the global pandemic, what's happening around the world and also Brunei, managing students and staff on teaching and learning, and what would be the current future in pharmacy education. Right, I'm sorry, I don't have any nice picture about Brunei. It's lovely picture about Brisbane just now, Queensland. Yeah, so but if you know where Brunei located Brunei is located in the Borneo Island, in between the East Malaysia, Sabah and Sarawak. So Brunei is a very small country, and the population is just over 500,000 population. Just a brief overview perhaps for the participants here. Brunei at the moment have 1 active cases, And we have total confirmed of 145 COVID-19 cases and total 3 deaths. So at the moment, only 1 is active, so in the isolation unit. So as we all are experiencing in this year, COVID-19 pandemic spread across the globe, and majority of countries are affected. Yeah, and majority of countries also announced temporary closure of schools, which impact around more than 90% of students worldwide. This doesn't just happen in big country, but also small country like Brunei. And after the announcement of our first COVID-19 case, which happened to be on the 9th of March 2020, 2 days after that announcement, all the primary schools and secondary schools were temporarily closed for the semester break. However, university remain open, but we also close in a way that we don't allow students to come in, but education carry on, continues. So we are also higher education such as University Brunei were also affected. Just to highlight, even before COVID-19 happened, the university already had some guideline. We heard about the lockdown in Wuhan in January. At that time, WHO have not announced COVID-19 as a global pandemic. Yeah, but we were worried as well. What if it happened in Brunei? Because during when SARS hit around 2000 something, SARS hit Singapore. Luckily, it doesn't really come to Brunei, but COVID really affect Brunei. So several guidelines were out since February to prepare us and what were the preventative steps against COVID. So these guidelines were prepared either nationally or university-wide. So again, the guideline keep on being revised from time to time, and on March 5th, the risk categories of COVID-19 affected country become more and more. Initially, it's just people coming from China will be inhibited to come to Brunei, but now become more and more as we hear on the news. Yeah. So on 14th March, 9th March it affected Brunei. On 14th March, there's a guideline for academic staff, and the guideline how to control and manage COVID-19 pandemic. So we all followed, and all these current guidelines provided from the top management, from the university. Yeah. So on 23rd May, our Vice Chancellor again write an encouraging letter and letter of motivation to all staff and students about the pandemic. Yeah. So that's quite nice as well. Just to give you a statistic, this is our building where I'm sitting now, the extension building. Now, this is our new building, just finished in 2016, around that. No, actually, 2013. Yeah, it's finished. So this is our new building, and in fact, our faculty or institute established since 2000 already. So the first course that we offer were medicine, and after which was biomedical science, and then the nursing college were integrated with us in 2009. And that's when we offer nursing midwifery. Then our faculty become larger and larger. But just for information, our pharmacy degree only offered or started in 2016. Yeah, so that's 4 years back. Actually, our first cohort just graduated. Pharmacy staff, we have 6 full-time academic with pharmacy background, and we have other lecturers with non-pharmacy background, such as like immunology, microbiologists, bioinformatics background. So these are people who help us with teaching some of our modules as well as adjunct lecturers, as well as including adjunct lecturers from the pharmacists from the Ministry of Health. These are pharmacists who are not actually employed by the university, but come here to teach our program on the clinical part. Yeah. So in total, the number of students we have is 42 students. So this is some of us. Recently, Brunei have gone de-escalation period now already now, since we have not had any active cases. Most of our cases are cases which were imported. Yeah, people come back from traveling and all that, and most have a strict protocol with were followed. Hopefully there won't be any community infection. Yeah. So what happened after 16 March? So the new normal started, the new norm started. So that's when we heard about this new vocab, yeah, after COVID, new norm. So all academic staff were asked to work from home, limit physical contact, and 14 days self-isolation if they come back from overseas. Initially with self-isolation, but nowadays it's no longer self-isolation. All were required or escorted down to the hotel, similar like in Australia. Yeah, all escorted to hotel with a strict protocol from the Ministry of Health. All must stay in a hotel, no visitors allowed. And definitely all teaching schedule were reset back 7 months ago in March. Only small group clinical skills and practicals were allowed with physical distancing. Our lab is quite big. Just for your information, our cohort is only like ranging from maximum is 13, 12 students per cohort. So we're not a big group, yeah. So PBL teaching session must be done online. So most of us opt to use Zoom. And we also have our own learning management system called UBD Canvas. So we also encourage to use academic staff to use Canvas. And we also, UBD recently bought Microsoft Team. So we use Team Meeting, Microsoft 360 package to teach, yeah. And occasionally, depending on the lecturers, some use Skype, some use WebEx. There's no strict regulation to say you must use only one platform, yeah. So that's encouraging. Also from the university side, training for academic staff continues in various online and blended learning by UBD have a center called TLC, Teaching and Learning Center, and C3L, Continuous Learning Center, yes, C3L. And they do provide training to academic staff as well as students who needed some support to use, say, for example, Microsoft Teams if they're not familiar with them. And there's also specific training on assessment just before the exam started, in case people don't know how to use the quizzes, how to use the MCQ platform in our LMS system, Canvas, before the exam started. So a lot of training going on via online for our academic staff. Sharing information also on up-to-date information on COVID-19 were practiced as well. So these are some of the online practical classes still ongoing. If you can see the title there, at the time there in July. In June, because this June and July is our semester break. Just for your information, our semester starts August to December, and second semester starts January to May. So June, July is actually our semester break. So some of these are my own certificate of video making forum, Canvas assessment, webinar. So there are more for blended learning, online activities, available resources. Plenty of support given by the university starting from March onwards up till now. In terms of me being the program leader, how I manage or we manage here in the faculty, our student during COVID, we work together with our management as well. Primarily, we want to continue pharmacy education online so that students can graduate on time and progress to the next academic year. So DY student, we have an internship which we call discovery year, whereby student will go one semester around 14 weeks overseas. I think Dr. Andy and Dr. Dewi will know this because we sent our 4 students last semester, August to December 2019 to United, yeah. So they attended this DY attachment or internship. So all students who were overseas doing their DY discovery from Malaysia, Korea, and United Arab Emirates were all called back. So these were the few students who were there, all called back and were supported by the Brunei government to buy their tickets straight away. So they were on a strict 14 days isolation. Alhamdulillah, none of them are affected by COVID. Yeah, I can report that. I was in touch with them. In terms of research students in hospital and health centers, some of our students are still attached to hospital doing their research, especially final year project, final year students. Some had to change venue because some of the health centers were used as a flu clinic. So no research can be done there. So it was chaotic. We have to inform ethics, that change of topic, title, venue. Topic remains, but venue change, you have to inform ethics. And some had to even at the expense of have to change topic to literature review. That's fine, as long as they have something to do. Admission for new student for the next cohort would luckily we managed to do our MMI, mini multiple interview. We do mini multiple interview for our potential students. We did that early, sometimes early March, and after which the announcement happened where we cannot do any more MMI, and all the admission meeting were done online. So these are some of the DY student achievement, whereby some of the students in fact published paper based on their DY literature review, risk factors affecting COVID-19, mobile health apps on COVID-19. So in terms of how we manage our assessment, so this was tricky. We learned also from our colleague from other program, for example, medicine program, if they've got some ideas or they have trial run their test run their exam assessment, we follow what's best for us. So assessment were all instructed to be done online. No exams was conducted. Exams supposed to be conducted sometime in April and May, but we cannot do that, all online. So what we did was we supervise, we monitor, we invigilate this one lecturer here. Dr. Hazim is a lecturer. So these are students who will answer their MCQ or SAQ in the UBD Canvas system, and they have to put extra phone like Zoom to show that there are no cheating going on. So lecturer, no students were allowed to switch off this video. So this is what we're also doing with our pharmacy students. Some who do not have internet connection or very fast internet connection at home, they're allowed to come at our facility to use our Wi-Fi system, but invigilators were all outside the room. So, but these are only for limited student number. If necessary, they were asked to be home. OSCE were done online, clinical skills were done online. There are some oral viva online, e-poster presentation online, and we also take into account PBL participation, only small number, 10%. Case study reports were given to students and fewer assignments added to increase the bulk. Yeah. So research deadline were also extended due to because of the transition. Some students had to start late because of change of ethics and change of venue and all that. These are some I want to talk about this pharmacy student core module. Majority of them pass their core module as an outcome. So these are the module that we have for our pharmacy student. Health science module, there are around 5 that semester. Skill and internship around 4 modules. And research module is only 1 for final year project. So just to show you some of the modules, these are some of the modules I'm convening. So N is the student number is just 12 for cohort 4, and cohort 3 is this earlier cohort which sit for the physical exam. Those student different cohort, this year cohort, who sit for their online test. So we see similar trends of student. Yeah. So for another module, we also see well, this is just to say 3 students have obtained a grade A. Here it's 2 students. So more or less similar. Mind you, the student number is small. Yeah. Here is a skill for our OSCE we have, because it's via online, we have to reduce the station. Normally we have 5 stations and now down to 3 stations. So our patient 1 is on a module, but again, we saw similar trends. Importantly, majority of the student pass. So this is cohort with online test and also physical exam. Right, sorry. Financial support for pharmacy students. A few students were given emergency SIM card in April to help them with if they have limited data. So these are to support them for their teaching and for their learning as well. Yeah. Just to inform you, our first cohort at completed their 4 years. As I said, we started in 2016, now 2020. So our first cohort of students have graduated and have done, is ongoingly doing the pre-registration training. Unfortunately, not like Queensland, we don't run the training here at the university. The training are done by the Brunei Pharmacy Board, so by the Ministry of Health. Yeah, so the placement are done by them. So what would be the current and future pharmacy education? So the new semester start end of July to August. The new normal continue. Orientation will conducted online. All lecture session will also continue to be online. Exams were instructed to be conducted online as well. That will be sometime in November and December. And fortunately, all our clinical placement, the internship in the hospital and health center are also allowed in Brunei, and a bit unfortunate, none can go out at the moment because of the unwillingness of the student. The parents a bit don't allow them to go abroad, yeah, and because of the country restriction as well. So for precaution, it's best for them to just stay in Brunei. However, as like what in Australia, we do hybrid. Some Brunei has undergone de-escalation, so some sessions such as PBL and practicals can be done face-to-face, and all students must be healthy and to scan the QR code provided by the Bru Health. What is Bru Health? Bru Health basically is a contact tracing app provided by the Brunei government. So basically, it's a color-coded screen whereby you self-assess. You can't really lie about your because it's connected to our Bruhem, our health information system with the ministry. So can't really lie your date or your date of birth, or you don't have disease, because it's connected. It will not allow you to proceed with the next. So you have to self-proclaim to this app every day, and it will come with 5 types of color code. Just for your information, green and yellow code are safe to go. Red, purple, and blue. These are those patients who need to who cannot go out. out. Yeah, basically you're gonna come to campus. So what would be the future of pharmacy education? Research collaboration is possible between the participating country in this webinar. As COVID-19 become one of the research niche in this faculty, more virtual seminar can be done between institution level as travel restriction continues, and use of technology such as virtual pharmacy. I like the idea how Queensland come up with the virtual dispensary there, something that we would like to learn. But the use of technology is possible now with the virtual pharmacy for teaching pharmacy student skills. Yeah, in conclusion, COVID-19 pandemic has affected many individuals, including us in higher education. However, faculty commits to helping students to complete their studies safely as possible through various adaptation in learning and changing the regulation when needed. So faculty also continue to support our students by facilitating learning when needed. So importantly, communication is the key between student and their mentors. So these are some of us who we handed our staff community contribution to the frontliners. So thank you very much for your time to listen to my presentation. So I'll just stop
Yes.
sharing.
Yes. Thank you very much, Dr. Nurul. Perfect time management. 20 minutes. Thank you very much. And then for those of you just joining us, welcome to this webinar. And also now we are approaching the end of session 1, and we will have our final speaker for this sessions. He is Dr. Raghu Radhakrishnan from at the Manipal Academy of Higher Education in India. And then his CV is, please, next slide. He is has a interest in the researching the oral cancer, and also he is the member of Fellow of Marie Curie Fellow, and also part of the Wellcome Trust DBTIA Intermediate Fellow. And he started his career as currently now as a Deputy Director for Research for the Faculty of Health Sciences, and also the Director of International Collaborations at the Manipal Academy. And he is also the member of Indian Association of Oral and Maxillofacial Pathologists. Please, Dr. Raghu, time is yours.
Thank you for that kind introduction. And is my screen visible?
Yeah, yes, it's functional. Good.
Okay.
Clear and clear.
Thank you very much for that kind introduction, Randy. So, honorable colleagues of the Faculty of Pharmacy, Universitas Erlangga, Surabaya, Indonesia. Congratulations on your 57th anniversary. So my presentation has 3 parts. And its internationalization efforts, India's national education policy, and the Corona crisis and the way forward. So I've always believed that the universities of the future have to be innovative, international, and research intensive. To me, that defines the institution that has the potential to become truly eminent. So where is Manipal? For some of you who have not been here, if you want some sunshine and warmth, Manipal is the place to be. So Manipal is a suburb in the rocky hinterland of coastal Karnataka in the south of India, about 8 kilometers east of Arabian Sea. So the genesis of Manipal is an enthralling story of a genius, late Dr. T.M.A. Pai, who had the vision of getting the society rid of 3 major ills: ill health, illiteracy, and impoverishment. He started a bank in the year 1925, which is nationalized today, Academy of General Educations to take the education to the doorsteps in 1942. And we had the country's first ever private medical college in the year 1953. 40 years later, Manipal became university. And when the university was celebrating its silver jubilee anniversary, the country conferred the coveted status of the institution of eminence to Manipal. So the university has a long history of being an institution of eminence in health sciences, technology, management, humanities, social sciences, and liberal arts. So Ministry of Human Resource Development's special status as an institution of eminence is a recognition of what has been done in the past, an acknowledgement of the potential to be a global future. MAHE, in its collective wisdom, have restructured the organization into three faculties: the Faculty of Health Sciences, Faculty of Technology and Management, the Faculty of Humanities, Social Sciences, and Liberal Arts. MAHE is home to 30,000 strong student community from as many as 70 plus countries all over the globe. So the strength of Manipal is in its 6 Sigma approach, which includes education through scholarship, exposure to diverse culture, innovation in teaching and learning, nurturing ideas and entrepreneurship, instill a culture of research to create new knowledge, and enhance employability. MAHE has identified 5 areas as part of an institution of eminence: excellence in education, exemplary research and innovation, expanding reach and internationalization, effective engagement in alumni relations, and enabling foundation and sustainable. I head the expanding reach and the internationalization team. Manipal also has planted bold footprints in SAARC, West Asia, in the ASEAN, and in the Caribbean region by investments in physical campuses. We also work very closely with several international organizations and corporates. So the proposed roadmap for impactful research outcomes at MAHE is to reinforce the existing research excellence framework and to create an ecosystem for sustained excellence in research. So with the Millennium Development Goals culminating in the year 2015, 2016 ushered in the launch of bold and transformative 2030 agenda for Sustainable Development Goal. The new agenda calls on countries to address 17 Sustainable Development Goals over the next 10 years. So we have prioritized the research themes based on scientific and social impact. And the action plan is to brainstorm with relevant stakeholders and outline a strategy to target research grants in these domains and be engaged in the cutting edge research. Building on our reputation, MAHE strives to be leaders in education, research, and services, which is in line with the vision of our founding fathers. Setting up a center of excellence would depend on the identification of niche areas of research, its national importance, social impact, and our internal capabilities. So these are some of the proposed centers of excellence at MAHE: drug discovery and delivery, emerging infectious diseases, virology, lifestyle disorders, oncology, personalized medicine, infectious diseases, nanobiotechnology, and geriatrics. And in the Faculty of Technology and Management, the centers of excellence proposed includes the avionics, the biophotonics, climate change, data mining, and image processing, energy, artificial intelligence and machine learning, medical devices, advanced materials, both renewable and non-renewable, applied nanosciences, computer networking, and information security. So the university has set up 100 plus unique centers, many of which are interdisciplinary. Some of the centers are in collaboration with industry, others are with university partners, and few others are with the research institutes. In its 10th year, Manipal University Technology Business Incubator Society has added a second incubator to MAHI, the bio incubator with focus on startups in medical devices, drug discovery, and molecular diagnosis has just received 55 million rupee from the state government. Overall management of research activities are coordinated by the Directorate of Research, a central office that facilitates and contributes research in all disciplines, thereby improving yield in terms of grants, research innovation, intellectual property, and publication. Manipal perhaps has the best library in the country. In-house central animal research facility provides healthy and inbred animals for research. A full-fledged central instrumentation facility has been set up to support multidisciplinary research. So my second part of the presentation is with regards to the National Education Policy 2020. So one of the key points of the National Education Policy 2020 is the establishment of National Research Foundation to foster a strong research culture. The primary activities of the National Research Foundation will be to fund competitive, peer-reviewed grant proposals of all types and across all disciplines, facilitate research at academic institutions, act as a liaison between researchers and relevant branches of government as well as industry, so as to allow breakthroughs to be optimally brought into policy and recognize outstanding research and progress. As with regards to the internationalization itself, the national education policy, as we understand, is a step in the right direction, signaling new normal. India will be promoted as a global study destination. Internationalization at home, which is the purposeful integration of international and intercultural dimension into the formal and informal curriculum for all students within the domestic learning environment, will be greatly encouraged. Another aspect of the national education policy is with regards to the expanding reach and internationalization. High-performing Indian universities will be encouraged to set up campuses in other countries, and those from among top 100 universities in the world will be facilitated to operate in India. So MAHI's own stated commitment to internationalization is to secure global recognition as an internationally reputed organization, facilitating knowledge and cultural exchange, recognizing diversity and being inclusive, creating stimulating environment, and enhancing international partnerships, having meaningful outcomes. So the Office of International Affairs, which I head, is active in establishing new collaboration and strengthen the existing ones. Our strategic partnership with the top 50 universities in the world will see a lot of traction in coming years. International collaborations have been redefined in the current year by signaling landmark partnership agreements with some of the top 100 universities in Australia. With equal allocation of resources from both partners, we are beginning to see some exciting outcomes already. So why is internationalization important? Universities around the world are grappling how best to equip their graduates with knowledge and skills needed to succeed in the globalized world. Given the breadth of institutions and the level of internationalization, as well as ever-growing range of partnership, one size fits all would not address the nuances and the realities of internationalization. So the question increasingly is not whether to, but how to engage with international partners. Governments around the world are implementing policies to fund study abroad, attract international students, develop innovative collaborative network, and encourage jointly supervised master and PhD program. So along with these opportunities are multitude of challenges, which may range from finding the right partner, evaluations and assessments, managing the cultural differences, identifying the right model of collaboration, and negotiating agreements. So in addition to the overall international strategy, institutions also have to consider how their international partnerships fits into the existing internationalization efforts. This is the ACE's model of comprehensive internationalization, which identifies 6 areas that requires careful attention. One is articulated institutional commitments, administrative leadership structure and staffing, curriculum and learning outcomes, faculty policies and practices, student mobility, and collaborative partnership. Institutional leadership is also very important in promoting and advancing international partnerships. University presidents and the vice chancellors are seen as primary catalysts for campus internationalization. A commitment by the top leader can send a strong message to the campus community about the priority laid on such collaboration. This in turn can influence decision about the resource allocation and other matters that impacts the ease with which relationships and programs can be established. While the nuts and bolts of internationalization will be handled by the faculty and administrative staff, engagement of institutional leaders at key points may be important from the cultural standpoint. So jumping off point for partnership is the office, which focuses on international matters, a curriculum that is infused with infused with global elements, and a faculty policy that supports international engagements. So the question now facing many colleges and universities is which partnership to pursue and how to manage global engagement activities in a planned, coherent way. While some institutions are identifying a particular geography and academic priorities for new collaborations, others are seeking to deepen and expanding existing collaborations. So in designing strategies and policies, it's important to balance top-down and bottom-up approaches. Centralization of some aspects of internationalization is necessary, such as signing of memorandum of understanding, academic requirements, and legal considerations to ensure that the partnership is consistent with the institutional standards. However, faculty engagement is critical to the success of international partnership. While some partnerships may be deemed strategic and targeted for expansion at the institutional level, informed faculty collaboration outside of these relationships is certainly encouraged. So internationalization is no longer a luxury. It's a necessity for providers of higher education. It can add value to self-financing institutions and is a strong component of their sustainability strategy. International student acquisition is at the lower end of the food chain of internationalization, and research collaboration has to be the way forward. International campuses provides global visibility, but need not be an integral part of internationalization. So Corona crisis and moving forward. One thing is certain, the impact of coronavirus is here to stay. COVID has turned the whole education system upside down. Distance and online learning has become the primary means to keep the doors of learning open. The current challenge of COVID-19 has provided governments and institutions with an opportunity to rethink their approach. So what are the questions before us? What are the initiatives the universities are implementing to respond to the crisis? What is the impact of the crisis that has impacted the recruitment efforts? When are the universities expected to reopen the campuses? And what is the support expected from the governments? India has a lot of reasons to worry, as we have reported about 4.85 million positive cases and nearly 80,000 deaths so far. So higher education institutions across the globe were quick to adapt to the new normal, moving classes and administrative tasks online and adjusting the application process. So how are the universities responding to the corona crisis? Majority of the universities have switched some of their courses online. Some of them have changed their application deadline for the next intake. Some of them have moved their acceptance deadlines for the next intake. A small minority of universities have postponed some of their 2020 offers to 2021. And some universities have delayed the start dates for some of the courses until the following semester. Why do you think that the international student applications will decrease? The 5 reasons we thought could be: the international students will be unable to travel to their country. International students will be afraid to travel. International students would want to defer their studies. International students would not want to study online. And lastly, international students will want to go to countries which have responded better than their own. So it is clear that more and more institutions are clearly relaxing their application and offer acceptance deadlines to give prospective students more time and flexibility. So what are the expectations from the government? To make it easier for students to obtain student visa. And like how India has established travel corridors with many countries, it's important that we establish travel corridors with as many countries as possible. It's also important for us to set up more scholarships for international students and extend the length of time on post-study work visa and have reasonable quarantine measures when they arrive in their country. While majority of universities hope to have the main campus reopen in the month of September or October, they're expecting now that the main campus will be fully open to students in January 2021. Majority of the universities surveyed believe that the teaching will be mostly online with some face-to-face teaching. Some hope that there will be an equal split between online and face-to-face teaching. And a small minority think that the teaching will be entirely face-to-face. So what are the measures that institutions can implement on campus? So the institutions can ensure social distancing on campus, install hand gel stations around the campus, put up signs around campus to show minimum distance to keep away from others, make wearing of masks mandatory for staff and students, and hold lectures and seminars in larger rooms to minimize close contact in large gatherings.
Apologize for
So in
interrupting,
conclusion,
Dr. Ragu.
coronavirus
Yes,
will continue to shape the way we learn, work, and interact for the foreseeable future. As higher education institution, we have to navigate this new normal because the health and safety of students and staff must be paramount. Universities must learn from each other and share their ideas and insights for how to deliver education and reopen campuses in a safe and effective manner. And I thank you for this opportunity once again.
Thank you very much to all speakers. Now it's time for discussion. So participants can raise their questions via chat box either on YouTube or your Zoom control panel. Now please pay attention to the format. You may also raise questions in Bahasa Indonesia or the Indonesian language, and I will have it translated. As I aware that Dr. Ragu will also have another appointment to go on 2:30. So would you still be available for some questions, Dr. Ragu?
Yeah, sure, please.
Okay then. Okay. Please, the questions from the audience. So there are numbers of audiences asking for questions, particularly for Professor Sarah and also Dr. Raghu. These are the questions from the audience. For example, from Novi, Dr. Raghu. How did Manipal start collaborating with other top world's top universities, and how do you have any suggestion for universities in Indonesia so they can start collaboration with top universities, and how to maintain during these pandemic situations? Other question is there any pathway or special pathway for Indonesian students to apply to become students at MAHE? Please, Dr. Raghu.
Yeah. How did Manipal start collaborating with the world's top universities? We have, as a strategy, to promote an effective academic and scientific community which can collaborate with some of the best universities in the world. And as an institution of eminence, in our collective wisdom, we want to serve the international community by offering academic and research programs of excellence. And then we want to enhance the international partnership and create synergy to enshrine the knowledge triangle of education, research, and innovation. And be an essential part of the global network for addressing issues of global relevance. So with these thoughts in mind, MAHE in its collective wisdom was conscious to collaborate with some of the best universities in the world. And that's how we went about it. We just didn't want to increase the number of partners for the sake of increasing the partnership. We were selective in engaging with some of the best universities because we are among the private Indian universities, and we wanted to retain that top spot.
Lovely. What about, is there any special pathway for Indonesian students to apply?
Sorry.
But is there any pathway, special pathway, for example, for Indonesian students to apply to Manipal, particularly in these pandemic situations?
So at this point in time, there's absolutely no international student on campus. In March, when there was a global lockdown, we had about 3,000 students on campus who all chose to go back. And from March till June, when we had the strictest of lockdowns, there were hardly any cases reported in India. And with the easing of lockdown and with the borders opening, we had lots of these people who returned from other countries like Italy, Iran, Saudi Arabia, Malaysia. And I think that is when the cases went up. And now we have reached a stage where we are not in a position to attract any international student. So what we are doing is to offer virtual internships for students and offering some of the virtual courses. Some of the partner universities, we are having a virtual student exchange where students can take some of our courses which are offered online, and the students from Manipal, because they are not able to physically move to another campus overseas, they are accepting some of the courses that has been offered by some of the partner universities.
That's nice. Thank you very much. Thank you. That's very interesting information for prospective student, particularly from Indonesia. We also have some questions to Professor Sarah. Please. Dr. Nurul, Professor Sarah. Now, first things first, Professor Sarah, there are questions from Nurlia. Can you please share, is there any recertification process post the student finishing their pharmacy degree in order to manage their skill or knowledge keep update when working in career? So is there any like recertification process in Australia after
Yes.
the students completing
Yes.
the degree?
Certainly. So all pharmacists in Australia that are registered with our National Registration Board must complete a certain amount of continuing professional development each year. And at the moment, that's the only way they keep their knowledge up to date. There's no actual recertification. So it's just continuing professional development.
And how long is the validity of, I mean, for licensure again? How long is it? 5 years or any other periods for the recertification?
No, it's just literally every year they have to do professional development. Okay. But there are some changes coming, but at the moment, no. Once you have your pharmacy degree, as long as you have to do your continuing professional development and you have to actually practice. So I'm still registered because I practice as an academic. But if I was to go and work in a pharmacy, community pharmacy now, I would probably have to do a period of supervised practice. So it's up to the individual.
So we have to collect, like, for example, a credit to renew our licensure, sort of?
Yes.
Perfect then. How about the degree for practicing pharmacists? Is there any special pathway for practicing pharmacists to, to undertake their master degree? Or, I mean, it is quite different to like new students in the undergraduate. They are practicing pharmacists, yeah.
Yes, so we have our Masters of Clinical Pharmacy, and that particular one is for somebody who's a pharmacist who wants to become a specialist, to become more specialized. And that particular program is online because we know people are working during the day. So a lot of the work happens on weekends. So that's the difference. And of course, they're treated at a higher level. And then our Masters of Pharmaceutical Industry Practice is also, it's face-to-face and it's usually full-time. So that hasn't got anything different from regular students.
Okay, thank you very much. So that's basically conducted in every in a weekend session, isn't it, for the professional students? Yeah.
Yes.
There are some questions again to Dr. Professor Sarah, I believe. Prior slide before this one. Hello. Yes, we still waiting for the questions, for another questions. Yeah. Okay, so there are questions from Gita, and then you can also read it from, it is available on your screen at this moment. So how you be design the online internship activities, how to ensure that the student skills are quite competent in the OSCE says. This is for Dr. Nurul. Dr. Nurul, you are still muted. Okay.
Sorry. How you will design the online? Actually, internship were not done online. It's face to face. The discovery year internship is face to face. Yeah. So, but if the student wanted to know how do we ensure student skill in OSCE, right? We use simulated patient because before this there was a face-to-face clinical skill conducted. So it's only towards third week of March, we cannot do face-to-face. So the exam was conducted sometime in April. So there are full period whereby we already taught student on some clinical skill. So OSCE was done online via Zoom. So there is one simulated patient and 2 examiner assessing a student. So this is how they conducted our OSCE. So we give them a case. So we call that one station. So either like a case for to practice their history taking or to practice their communication skill, or a case on inhaler technique. So students do it in their home. We assess it from our office or from home using a structured rubric, assessment rubric, like before.
Yes, thank you very much. I've just received a chat from Dr. Raghu. Thank you very much, Dr. Raghu, for your participation in this webinar. Really sorry that you have to leave earlier. Thank you very much again for your contributions.
Thank you very much for giving me an opportunity to participate at this event. It's been a pleasure.
See you then. See
Thank you
you
very
again
much.
in December.
I
Bye.
wish to interact with you soon. Bye.
Thank you very much. Thank you very much.
Thank you, Dr. Sarah. Thank you, Dr. Nurlani.
Thank you, Dr. Agus.
Thank
See
you.
you.
Thank you, Annie. Bye.
In touch.
Bye.
So we will continue again with the question and answer. So as far as I know that in your OSG test, there should be 5 stations to be tested.
Yeah.
And then in fact that there were only 3 stations as part of the test. Yes. And how will you ensure that the competency is achieved during, I mean, from 5 stations to 3 stations? How will you ensure that the competency of the future pharmacists is achieved?
Okay, that's only one component of the module. They're still in their first year at that time. So these are just temporary measure. We will revisit because our curriculum is in such a way that we will have other skills in different module in different years, and we can always enhance the skill throughout the year. So this is only one part of a small chunk of the whole big curriculum of their skills. Yeah.
Perfect. Thank you very much. Professor Sarah, there are still a number of questions for you. Unfortunately, we cannot share it in the screens now, but I will read it for you. So there is one questions about how would we apply for as an international student to get scholarship amid the pandemic, especially for the PhD program. Uh, is there any change before, I mean, during this pandemic? Is there any change in the admission process or something like that?
No, there actually isn't any change. So it's via our usual scholarship mechanisms, which are all on our website. And for doing a PhD, is the best way to go about it is to find a supervisor, and then they will assist you in putting in an application. So that's that. We, for all of our programs across the university for this semester, and I'm not sure it might happen for first semester next year, for anyone studying online, they're getting a tuition fee discount or scholarship. And also in our own master's program, we have bursaries, which when you apply for admission, you become eligible for those. And we can send that information through.
Thank you very much. So the process is same, and then you can also look for the supervisor for first for the PhD admissions. You also have
Yes.
already answered the one question, that is there any discount or specific tuition
Yeah.
fee for application during this pandemic? But yeah.
Yeah, they haven't announced for first semester next year, but I'm sure in the next few weeks they will make an announcement. But for this semester, it was 12.5% discount on our international student fees.
Thank you. Lovely. Thank you very much, Professor. So for both speakers, I would like to know whether when will be is there any plan to reopen the campus shortly within this year or probably next year? Professor Sarah first, probably. Is there any? Yeah.
Yeah. So our campus has never actually closed down per se, and so people have been able to come and go. But we are, as I mentioned in my talk, we're in a hybrid mode. So students can come if they can access the campus, if they're locally, and if they're not feeling unwell. And I think the same will happen in semester 1 next year. So it's hybrid. And at the moment, we're waiting to find out when the government will reopen our international borders. And we hope by second semester next year that they'll be open. But of course, who knows? Who knows?
Yeah. We also wait for the possibility as well. So what about in UBD, Dr. Nurul?
Oh, thank you, Dr. Andy. So basically, right. Again, similar like in Australia, we haven't really closed our campus. Students can come, but in small cohort of students. It's a hybrid mode. We implementing when they do come here for practicals or small group weekly PBL. So we see students come here and go. But again, we just practicing, and we implementing students to actually use their app for contact tracing, and any unwell student must report if they're unwell. So nowadays, if they go to health centers or hospital, if anyone have got flu, it's like automatic. You get 3 days off, 3 days not going to campus. So and Brunei government is really strict with this act. In fact, few people or few restaurant, if they don't following or regulating the rules, whereby if your client are not QR coding themselves before they enter the premise, they will got they'll be fined. So the government is really like enforcing this. So
yes,
here as university, each campus or each building have got their own QR code.
yes, of course, it is necessary to develop a strict protocol under these circumstances. Yeah. So I'm just wondering if for particularly in the research environment as well. So I'm just wondering if you, Professor Sarah has already mentioned that when you want to do research in the laboratory, you have to do the online or social distancing between the other researchers or other fellows within that laboratory. But how about if you are doing your research in the community, or like for example in the hospital project, do you have to reschedule, or do you have other policy for such kind of research?
In Brunei?
Yes.
Yeah, Professor Sarah.
Okay.
Oh, okay. So it depends on what populations you are working with. So when the pandemic first occurred, all face-to-face research stopped, and then as we've become better equipped, some of the research is starting up again. But you have to, I guess, literally do your own risk assessment and decide, what you need to put in place. But also, if you're working with those populations who are at higher risk, such as aged care, that's not gone back yet. So a lot of our care, which is where in Australia our deaths have occurred, to normal. And if we can't socially distance, if we have to show a student how to do something, we wear face masks and protective equipment. But I think human research is still lagging behind that.
Yes, indeed. It is particularly difficult for vulnerable populations like the aging people, yes. What about the policy in UPD, Dr. Nurul? Do we still have opportunity to conduct a community or patient project sort of things?
Okay, for similarly, like in Queensland, like what Prof. Sarah mentioned, lab research has continued now. Initially in March, it stopped because we were quite uncertain and the cases were high. And now there's a lot of policy has been in place about how to do research, and because of the contact tracing apps are available, so student can come back to the lab. And community work, not research, but we have a module in this year 3 students in community work. Now they are allowed with a certain specific group, like they're just going to schools and public, but they still have to practice the social distancing, wearing masks in a very crowded area. So there are a set of protocol that Ministry of Health, and we also follow the risk. They have to do some risk assessment form before they go out and do all this research. So similar like in Queensland.
Yes, that's also problematic as well in many countries. There is questions from Ibrahim Muhammad Abdul about how the students were able to cope with the virtual classes, as we know that the pandemic has pushed us to do everything online. How they were able to cope with these situations, and is there any survey research that tests its effectiveness for doing everything or for doing the learning in the online way? Professor
So,
Sarah?
yeah, sure. It's a really good question, and I don't think that we have enough data at the moment to know whether the learning has been effective. That's a really good point. How have the students coped? From the research that we've done within the university, we really found that they struggled with motivation, and that there were real issues with mental health and anxiety. A lot because not just online, but because everything around them was changing. And that was why we tried very hard to maintain that contact, like having drop-in sessions, and why the university was checking in on students, and we were hoping or using a lot of social media and getting students to support each other. So really good question. Effective learning, I really don't know, and I'll be interested to see not just our university students, but really and truly how it's affected our later years in secondary school.
Perfect.
Interesting.
Any
Interesting
experiments
question.
in UBD?
Right. As for us, we at the university, our group didn't actually do that, but we have our office in the office of vice chancellor, assistant vice chancellor in education and academics, have conducted a university-wide survey to students. So I have yet to hear about the results. So I don't really have the data with me now. But I think it will be similar like in Australia. This is what I've been hearing. We recently, last weekend, we had an ASEAN Dean's Forum just specifically for School of Medicine. So these are again keep coming. Mental health problem or issues arises. Students were quite depressed and stressed with the change of routine and if they live in quite a remote area. So these are keep on coming up, but these are from other countries survey. But I guess I look forward to see what UBD survey will be. I think it will be presented by the office soon. Yeah.
Yeah.
So I don't have the data, but it's already being done at a university wide, so not just for pharmacy students per se. So a bit
Yes.
interesting to know.
Yes, interesting, because I think the our perceptions toward the situations has changed. Everything has changed. The geographical borders has changed. Everything has changed, and this is not likely what we experienced before the crisis. So, in fact, I believe all of you perhaps agree that initiative previously predicted to take decades or years were implemented in a matter of days. These under this crisis situation, so it's going to be a challenge for everyone as well. So thank you very much for the discussion session. We have plenty questions, and then I'm really happy that you, either both Professor Sarah and also Dr. Nural has come to one similar sense that this is a challenging situations, and also we all adapt with the current situation as well. Thank you very much for your participation in this webinar.
Thank you for inviting us.
Thank you very much,
Yeah.
Dr. and Professor Sana.
Thank
Any
you
last
very much.
Any last statement before we end up the first session?
I would just again like to say thank you, and how interesting it is to find that we are in such a global society, yet we are doing the same things. We've, Brunei seems to be exactly the same as what we're doing here, and I'm sure you are as well. And so thank you very much. And I apologize, but I need to leave now. So I say thank you very much to everyone.
Thank you very much, Professor Sarah. Dr. Nurul?
Thank you to the organizer. Thank you, Universities Indonesia, Universitas of Erlangga, for inviting me for this webinar. Thank you, Dr. Andy, for facilitating this forum. Very well done. Job well done to all of you who have worked hard to actually organize such a wonderful seminar, and congratulations once again for your 57th anniversary.
Thank you
That's
very
all.
much.
Yeah.
Thank you very much. Thank you very much. Professor Sarah, as I'm aware that you will have another appointment, please receive our appreciations for your contributions to this webinar.
Thank you.
It's a virtual certificate.
That's lovely.
with the promise that next year when we have a time to go to Queensland, I may not forget to bring this certificate as well to you. Thank
I
you
will.
very much.
I look forward to meeting people in person.
Thank you very much. Thank you very much.
Thank you,
And then
everyone.
the certificate of appreciation is provided to Dr. Nuralaini. Thank you
Thank,
very much for your wonderful speakings in this webinar.
thank you, Dr. Andi. Thank you, Dr. Umi.
And then last but not least for Dr. Raghu Radhakrishnan, and thank you very much for your contribution as well. Well, ladies and gentlemen, audience, we have cleared up our first sessions, and then we are about to go to our second sessions. But again, just a quick reminder, please be aware that in order to obtain e-certificate, participants need to fill out attendance list, and then you need to be online during this webinar, and you need to fill out the post-test questions at the link which is currently displayed on your screen. And you can still submit questions through questions pane or chat box in your Zoom or YouTube control panel. Once again, thank you very much, Professor Sarah, Dr. Nural, and also Dr. Agru. You may leave the presentation room at this moment, but Dr. Nural, if you want to stay, I'm really happy to have you on board as well. And then for the second session, we will have another two wonderful speakers on the line. First, we will listen to presentation by Dr. Fazren Asmi. He is the lecturer and research fellow at the University Kebangsaan Malaysia. His research focuses on peptides, nanoparticles formulation, immunoadjuvants, and lipids with a focus on anti-infective and vaccine development. He received Young Scientist Award in the 4th Permata National Noblest Mindset in 2016, and he is now senior lecturer in the UKM, start from 2016, and also head of industry and community partnerships of the Faculty of Pharmacy at the UKM. He is the chairperson of KRA 3 of the Faculty of Pharmacy at the UKM as well, and also member of the European Peptide Society. Ladies and gentlemen, audience, and also all the viewers in our YouTube channel, please welcome Dr. Fazren Asmi.
All right, thank you, Dr. Andy, for the kind introduction. I'll just share my slides first. All right. Assalamualaikum. Hi, and a very good afternoon to everyone. First of all, I would like to thank the organizer, Faculty of Pharmacy, Universitas Erlangga, for having me here in this webinar today. And it's my pleasure to talk alongside an academia from global institutions, especially with the representative from my alma mater university, which is UQ. And I believe that most of the strategic global partnerships have been well elaborated by the earlier panelists. But in this webinar, for my talk, I would like to emphasize on how we can utilize the concept of VUCA as a coping strategies in dealing with this current COVID-19 situation, particularly in the area of global partnership. Of course, COVID-19 has a massive impact to the education sector globally. And the schools and teaching institutions were forced to close to contain the spread of the COVID-19. An international student has the difficulty to return or to travel back to their institutions, which might cause them to defer or delay their enrollment. And of course, when we talk about deferring enrollments, there's a huge impact in terms of the income. Especially we know that for the English-speaking countries like UK, US, and in fact even Australia, they are quite known for the education tourism, and one of their source of income might be coming from the enrollment of the international students. So in general, there's a decline in the global students' mobility. Similarly, in Malaysia, COVID-19 has a massive impact on the education sector in Malaysia. In particular, for the private college, some of their proportions income coming from the enrollment of international students, and we couldn't have the international students to enroll and to continue their studies. It means that we can face a financial pressure, and when there's a less income, there's a possibility for people that working in academia sectors to losing their jobs, especially for the contractual staff members. Of course, now, as part of the strategy, most of the classes have been moved online, but there are certain challenges remain. For example, in Malaysia, especially in the rural area, we still don't have a stable internet connection, and this can lead to difficulty in doing things online. And another thing is, for example, like the Faculty of Pharmacy, like us, we do offer a practical, which is required physically to be there and hands-on approach. And this is quite somehow challenging when we want to switch to the online teaching completely. And of course, everyone has mentioned earlier that we are now on a digital education. It's a clear step forward, especially in this COVID-19 pandemic era. But we also need to be careful in terms of the hacking, or the cybersecurity need to be complemented with a good cybersecurity. So whenever we log in or anything we do online, we should not be exposed of being hacked by the scammers. So basically, this is the current phase in Malaysia now, is that we are currently having a recovery MCO. MCO stands for Movement Control Order, and the recovery means that at this stage, most of the business, they are all back in order, and the university students, they are allowed going back to the campus gradually, and now by month of October, we are expect them to be back in campus already. But of course, while having this recovery MCO, everyone need to comply with the strict guideline by the government. For example, like to wear a mask is compulsory in the public areas, and to practice a strict social distancing, like all in the areas in the country. So here, what I would like to emphasize is that the life that we are currently have now due to the COVID-19, which is the new norm, is exactly a reflection to a VUCA concept, where V is a stand for volatility, U is the uncertainty, and C, complexity, and A, the ambiguity. So the VUCA concept was first introduced by the US Army when they described the post-transition from the World War II. And what the situation that we're having now with this COVID-19 pandemic is exactly a reflection on the VUCA environment. For example, now, for the volatility, you always have things that can be changed rapidly and in an unpredictable manner. For example, now in Malaysia, we are now have the recovery MCO, where everything is back in business. But who knows now, with the increasing rate of the infections, we might turn back or switch back to the lockdown situation where everyone need to work from home, stay at home, and we have a really restriction movement order again. And then the uncertainty. For example, now with this COVID-19, everything's are uncertain. Even now, we are uncertain when the vaccine would be made available for public use. And complexity, where now with these COVID-19 outbreaks, everything is becoming more difficult and more complex. For example, for the government to implement new policy, whether we have enough expertise to deal with the COVID-19 and so on. And stuff is just getting more and more complex these days. And then we have the ambiguity that reflecting to a situation where we don't know what are the cause and the effects are still unclear. For example, researchers now are still gathering data on what's the actual source of the COVID-19, either it's man-made or it's naturally produced. And we also don't know yet. We have some ambiguity in terms of on how we can deal with this situation and how we can effectively stop the spreading of COVID-19. However, does this mean that we need to be defenseless against this VUCA situation? There are a few things that we can take into considerations, and this is what we call a VUCA antidote. So, for example, here, the volatility can be countered with a vision. So, as an organization, we need to have a vision on what the things that we need to develop in order for us to move forward. So, it's the ability to see through the fog and have a vision ahead of the organizations. For example, now researchers need to continuously doing the R&D in order to find a cure or to find a vaccine for COVID-19. And of course, we need to always to find a solution for the matters that arise due to COVID-19. For example, like I mentioned earlier, we might have some sort of difficulty to conduct the practical session via online platform, but we need to think ahead and we need to start move forward and rethinking to have a virtual laboratory where we can conduct this via online platform. And the uncertainty, we can be countered with understandings, which means that we need to know what are the strengths of our organization and the potential blind spots in order to pick the best strategy that can make use to advantage to us. So in order for us to be able to really understand, we need to be resourceful and we need to be able to understand and so that we can scheme the best strategy to overcome certain matters related to COVID-19. And complexity can be countered with clarity, where we need to be able to apply a solution in a quick manner to make a wise decision at a stage that we need to be quick and to respond wisely. And the ambiguity can be countered with agility. It means that we need to have an effective communication across the organization in order to ensure that whatever we implement can be done in a best way. For example, if the faculty decide to go for online examinations, all of the staff need to be aware and need to be able to respond accordingly, and everyone need to be in the same order. For example, so we need to be sure that for this online examination, the student can do their own online and to avoid them from do the tricks, copy each other. So we need to be sure that there are strict deadlines that we all need to come together to think in order for us to implement such examination via online platform. So in general, what we can conclude from the VUCA antidote is that to effectively face the nature of the VUCA environment of the COVID-19 pandemics, is we need to make use the area that we can control and is of great importance. Means that we need to be sure that we know what are the stuff that we can control and how we can make use of it, and to ensure that we always look on the positive sides beyond the negative. Now, let me see how we can utilize the VUCA concept and its antidote in dealing with this COVID-19, particularly in the area of global partnerships. So we know that most of the countries now closing their borders means that there are travel restrictions. Travel restrictions means that scientists could not attend a conference, where usually scientists share their scientific findings. And when we have a travel restriction, there will be trouble with the international student enrollment. And with all these consequences, it can lead to massive recession, where we have some sort of lesser income in terms of students' enrollment. And of course, these days, there are several emerging new problems like xenophobia and the increase of global insularity means that there's some sort of phobia that we always think that the COVID-19 is origin from China, and maybe we are somehow have some fear when we deal with students from China. But we know that China is also the one of the high in population, and they have a lot of their students being sent abroad. So here, how we do reshaping our international collaborations in the COVID-19 era. Of course, we need to have a really good measure to ensure that the global partnership can be sustained and always ongoing. For example, for our mobility program, actually, we used to have a mobility program that being held annually in Malaysia, actually, where we gather the students from our partnering universities from Southeast Asia, especially for our educational and research mobility 2019. However, for this year, during this pandemic era, we could not host it physically, but what we're gonna do is we're gonna turn it or switch it into a virtual mobility programs. Of course, it's not gonna be the same when you are not being physically here in Malaysia to really to see the beauty of Malaysia, to enjoy the culture, and to see how the health systems works here, and to see the manufacturing companies or pharma companies in Malaysia. But let's have a look at the positive sides, which means that when we have this mobility program in virtual platform, it can save costs, and of course, more students have access to this program. And of course, at Faculty of Pharmacy, UKM, we are committed to ensure that this virtual mobility program will be conducted in a best way fashion to mimic the actual program that when we used to have it in a physical platform before. So for those interested, we will spread the news on our first virtual mobility program soon. And in terms of UKM strategy, we do have a virtual exchange program. So for this virtual exchange program, it will be started in October, which is next month. And this initiative provides opportunities for students from partner universities to join a semester or an academic year, or 1 or 2 semester studies where they can enroll and take the credits. It's like a inbound program as well, but we do it virtually. But unfortunately, there are just certain program or courses that we are having this in terms of the virtual exchange program by UKM. And if you are interested to know more about this, you can go and search in the website of UKM Global. Just type UKM Global, then there's a details on this virtual exchange program. But unfortunately for us, Faculty of Pharmacy, we didn't offer this virtual exchange program yet, but we are working on it. We are strategizing on how we can go online as well for the inbound program. So not yet for Faculty of Pharmacy, but soon we're going to have something in terms of the virtual exchange program. And then we can see on the digital education revolutions, where I think in Malaysia, we do have, and in global, that we have these terms that call MOOC, which is the Massive Open Online Course platform, which everyone around the world can enroll and is free and accessible to everyone. And these are the platform that utilize the MOOC program, with like the Coursera, Canvas, EDX, and the Future Learn. In fact, some of the university offer their courses via MOOC, and there's even certification that they can obtain by completing the MOOC, which is the online program or online courses. In fact, in our faculty, we do have certain courses that have been converted into MOOC. For example, more to a more general courses like Pharmaceutical and Pharmacy industry. So via an open learning platform. So if you're interested to join this course, you can always search and just type MOOC UKM Faculty of Pharmacy. There's a list of courses that is available via MOOC platform, which is the massive open online courses. And in terms of research, we should not let the COVID-19 pandemic stopping us from collaborating in terms of research. Especially, it's highly important at this stage that we all need to be able to collaborate at a global scale, how we can find the best cure, find a best alternative, and a prevention measure against COVID-19. Of course, there's a lot of online platform like the one that we're currently having now, webinar for knowledge sharing, and we can have a teleconference and a virtual conference where we can share our scientific findings. And recently, I have sent my student for a virtual annual meeting by CRS, Control Release Society. It's quite familiar to Dr. Dewi, I guess, CRS. And they're having their virtual conference this year. And the response is quite positive. They have a lot of participants sharing their input in this virtual conference, especially when they have a new section on how they can deal with COVID-19 and on the recent findings on the COVID-19. And it's really important that we should have a sustained international collaboration, especially in research relevant to COVID-19. For example, for vaccine development, for preclinical development of vaccine, it's really important that if we can have a sample or the COVID-19 strains from different sources or from different countries. We might not know that the strains in Australia, for example, or the strain in Indonesia and the strain in Malaysia of COVID-19, they might be different, or they might have undergo some sort of mutation. So all these vaccines need to be able to work on all type of strains and to all type of ethnicity. So at this stage, it's really important for us to collaborate and to send samples so that we can know whether the vaccine that is currently working is effective enough for global use. Take a lesson from Dengvaxia. It's been developed previously, but when they first introduced into for global use, the vaccine somehow not really effective in Southeast Asia because the dengue virus for Southeast Asia is a different strain, and that vaccine is not 100% workable for this particular strain. And in turn, it results some sort of adverse reaction. So the Dengvaxia for the dengue vaccine has been recalled back from the market. So that's why it's really important that we can test and we can do all the COVID-19 research by having a collaboration from multiple sources and from multiple countries if possible, and to ensure it's working well for global use. And for the survey-based research, for example, we always have a research on to measure the awareness, knowledge, and practice on COVID-19. It's good that if the researcher from different countries can collaborate and compile their data to have a more meaningful impact, because every ethnicity, different people have different view and different awareness. So when we have more data, a bigger data, the outcome would be more meaningful in order for us to deal with COVID-19. And of course, recently, we just had our PhD Viva online. So with this, actually, there's no reason for not to collaborate in research. As we now moving forward to digital platform, overseas supervisor can always track and monitor the progress of the students via online platform, and we can always participate on how to discuss on the research by utilizing the recent technology. Especially we have a lot of virtual platform like Zoom or Microsoft Teams. So there's no reason for not to collaborate between the researchers from different countries. And moving forward, to move beyond boundaries. We do have several established platforms like the Global Gateway Campus or micro campus networks and the online program management, where for this model is that one of the main campus can set up their small local branch at the local university, partner with the university. For example, maybe a University of Queensland Faculty of Pharmacy can set up their branch in Indonesia or in Malaysia. But of course, we need to discuss on the syllabus, on how we can deliver, and to ensure that we meet all the requirements by the Faculty of Pharmacy in Australia, for example, on how we can deliver and for the students to obtain a similar certificate, a similar learning experience as the one they might have when they enroll in UQ, for example. And similarly to Malaysia and Indonesia, you can always have a partnership like micro campus networks. You can have a dual program together, like Faculty of Pharmacy UKM and Faculty of Pharmacy Erlangga. We can share on our OSFI, clinical studies, and we can do that by engaging with a private and with a local academia from that particular universities. This platform is actually already established in the University of Arizona, where they have their micro campus across the globe. And another thing is that we can look forward is to have a virtual internship where, for example, for us, all the students, they are required to complete an industrial placement before they can graduate. So, but now having an industrial placement is somehow quite difficult because of the COVID-19, and the companies, sometimes they're not really willing to accept a physical internship from the students. So what we can think of is they can have a virtual internships. And of course, this virtual internship can be arranged with a partnering university as well, like from the Faculty of Pharmacy, University Erlangga, for example. For example, I already talked to one of the biggest pharma company in Malaysia, like the Pharma and Pharmaniaga, and they're willing to design a task online to accept students from international students to do their internship virtually. All right. So similarly, goes to University of Pharmacy, Faculty of Pharmacy, Erlangga, for example. We can always collaborate on how we can think and how we can move forward to arrange for a virtual internship for the pharmacy students. And as a conclusion, of course, the crisis will always come and go over time. And we must expect that the future will always bring a new, unexpected crisis that will need to be handled. And how we can always cope with this VUCA environment and how we can respond strategically by applying the VUCA antidotes means that we always need to be sure that we are prepared whenever we facing some sort of this type of difficulties. For example, in this that we need to capture what sort of stuff that we can learn from the emergence of this COVID-19 pandemics. And alternatively, it also bring a new hope for our new partnership that could bring us together. For example, if before we do research remotely among the countries, but now we can merge together and sharing samples, sharing expertise to come to the best solution in research for COVID-19. And as Winston Churchill once said, you should never waste a good crisis. There should be lessons to be learned in this crisis. And with that, thank you very much.
Thank you very much, Dr. Fasren, for the wonderful presentations. And then I do agree about the VUCA during this crisis. Really, it's a been challenging situation for all of us. And then we will proceed to the next speaker. We will have after from Malaysia, we will fly back to Indonesia, and then we will have our last speaker at for this webinar. Our final speaker is Dr. Devi Melanie. Yes. Our last speaker is Dr. Dewi Melani, Dr. Apotheker Dewi Melani. She is the Vice Dean for Research, Community Services and Partnerships at the Faculty of Pharmacy, Universitas Airlangga, Indonesia. And then he has a long journey and interest on research. Next slide. On the investigations of microspheres and nanospheres using natural and synthetic polymers. And also he has another research of interest on drug, protein, and vaccine delivery systems for oral, pulmonary, and topical applications, as well as development of natural sources for topical microspheres. She is currently the Vice Dean for Research, Community Services, and Partnership, start from 2015 up to now, and then she is also the member of Indonesian Pharmacists Associations and also Forum Vaccine Delivery Systems. The time is yours, Dr. Dewi Melani Haryati. Thank you very much.
Thank you, Dr. Andi. So let me share my slides. Okay, so can everyone see it? Okay, yep, thank you. So this is the last session for today. We would like to share about managing global partnership in this COVID pandemic. And this sharing, let me introduce Universitas Airlangga first before we go through the Faculty of Pharmacy, Airlangga University. Oh yeah, maybe for everyone or Dr. Fajran, last time, have you came to our campus, this new building in this faculty, and also Dr. Nurul, and we hope Professor Sarah and Dr. Ragu also can have opportunity to visit our campus next year or next time. So this Airlangga University consists of 14 faculties and distribute in the 6 campuses, and it has one postgrad school. And now Airlangga University is in the top 520 in the world-class university QS rank. So I believe everyone here in each university moving forward to go to the top class university. And we have 39,000 students with 2,000 lecturers. And also currently we have more than 170 programs, which has a international accredited and also national AUN certified. Now we move to Faculty of Pharmacy. We also accredited by ASEAN, internationally accreditation, and certified by ASEAN University Network. And we are third best Faculty of Pharmacy in Indonesia. And with this new building, we are happy to say we are now have an international facility standard, because we are now have a CBT center, OSCE center, as well as the previous one, the assessment service unit for drug, herbal, food, and cosmetics. This assessment service units and also pharmacy drugstore is still in the campus B, different campus, and now we are in this campus C. Okay, so what's happened with the COVID-19? This is a global pandemic, and everyone in the workplace try to set up how to get the possible as they can, because the lifestyles was changing and keep changing until we don't know yet. Our Indonesian Minister of Health decree about early of March 2020, they released the guidelines for prevention and control of coronavirus disease COVID-19 for office and industrial work. How to keep sustain the business and working as usual as we can. Of course, by minimizing the risk and also the impact in the workplace, including higher education, where is one of the potential place for COVID transmission, because we know we have a number of people stay in one location. So what's our university stand on? Safety is our priority for students, academics, and supporting staff. That's why virtual or online teaching, learning, research, and partnership is the best option for now. And very limited offline activities, only for emergency case, which online is not possible, then we can do it. So what is the platform for this online? Erlangga have Aula, Erlangga University Learning Application, and also Erlangga has established a grant for massive open online courses, MOOC. And also UKM also have this kind of program. And Erlangga provide the Zoom education, and Zoom Edu platform is consists for 100 to 2,000 participants capacity. So every class and also every study program can write their proposal, what kind of Zoom capacity that they need. Then Erlangga, through the Aula platform, will provide these services. So Aula is our main Erlangga system to support the e-learning. It's actually not the new one since the COVID came, but it becomes more famous and everyone more get used to use it since this COVID pandemic. This Aula hosted by Center for Learning Innovation and Certification, it called PIPS. And this education transformation is formed to respond to the development of technology nowadays. Besides that, Erlangga has a division focused to create international program to increase the participation of the academic community in the global mobility. And some of famous programs are Amarta. I believe people from Malaysia, Brunei, and India maybe have heard about this. This is a full-time program for 1 to 2 semesters, and this attracts foreign students because it has a distinctive program to offer. And Faculty of Pharmacy is one of the participants for this Amarta program as a host, especially for Indonesian traditional medicine subject. The second, third, and fourth one is the tailor-made programs. Since COVID pandemic, it becomes more popular as a tailor-made, and it's moved forward to be online program. And the COP, or Community Engagement Program, is the specific program focused on community services, whether others still focus on academic field. And the new one is Dakota, video conferencing with Erlangga. So this program to build the network between an UNER college. So professor or assistant professor can become involved in these activities, and also provide the course and relevant to the expertise. And this is the COP program. This is the International Community Outreach Program. And it is nowadays, because Erlangga and also I believe all universities going to achieve the program which related to SDGs, as I think Dr. Ragus also mentioned. SDGs now is a part of the QS or THA rank. So then this program kindly specific to achieve that aims for increase the university rank. How about the academic activities in this faculty? So we start this semester and with the online course, and we plan, still we mentioned we plan to start the laboratory practical with offline on November, but in here I put in a bracket. So we keep updating the government's new decree because we don't know yet about the condition of this COVID. And of course, we provide the strict health protocols if the offline laboratory. And how about counseling? Yes, from Australia, Brunei, India to Malaysia, we have the same problem. Students will struggle with the motivation and also internet connection and other social problems. That's why counseling is the main priority for students. And we try our best to do that online. And how about the internship? Yes, some community pharmacy agree with the online internship. Some industry and less of community pharmacy. Most of community pharmacy choose the face-to-face internship still. But practitioners from industry mostly agree with the online virtual internship. And for hospital, yes, even though it's a limited offline with the health strict protocols, but there are some adjustment in the case study in the internship program. How about research? We know that our research mainly based on laboratory and non-laboratory. For non-laboratory research, we can say easily modified into online research by questionnaire or consultation online. But how about lab-based research? We still planning to start it maybe next month, but still depends on the national's condition in response to COVID pandemic, because safety is our priority. So in the meantime, the supervision was done by online. And how about the final thesis research for bachelor? It's been modified into, we cannot call it literature review because it's still far from the perfect literature review. So maybe we can call it's like a mini review article. And we try to get the topics related to the real proposal of their laboratory topics. So then students will not get lost about their interest and also their motivation, because actually most students really want to go to the real lab doing their experiments and finish with the good results. However, with this situation, then we need to adjust into the mini review article, but still the topics related to their lab work. And how about the grants for research? Yes, COVID-related research is majority interact with the national grants, local and national grants. So research topics with this grant, I think only in 1 month, then yes, they will get the grants. But still other people with their expertise, of course, they still want to continue their research in their topics. And yeah, until now, the government still allowed to continue their project, even though the progress is very low, very slow. So in the Erlangga University, we also involved in the research consortium, such as the Asia Uninet, the Asian Network on Microbial Utilization, the AIC, Australia Indonesia Center, SATU with Taiwan, and WEIJUK with the Western Australia Consortium, and UMAP with the Asia and the Pacific for students' mobility. How about other international programs for the international seminars. So with some of them, we moved to online, virtual webinar seminars. And also for student exchange, yes, as Dr. Fazren mentioned, now become very slow. So we just also get the opportunity for student outbound as the students, as the speaker in the forum talk in the UITM Malaysia. And also we have a new program, the International Undergraduate Program, commenced this year, September 2020. And we tried this program as the first English program because we haven't got that fully English program before this program. And also Dr. Andy also planned to have international joint class with the UITM in the one of subject. And how about the research? Yes, so luckily for international joint research, we still have many partners. So we can work in each universities and then we write the joint publications. Not only with the COVID related topic, but still with other people interests. And how about the alumni? Yes, we try to keep the gathering alumni by online. So some lecturers, some alumni. So we have a 1 or 2 forum or seminar or webinar just to get in, to keep in touch and to share all the experience during this COVID pandemic. So hopefully we keep the network with alumni stronger than even before, because now we can also contribute more to the to fight against this COVID. And we still have a young professor activities. The differences is just we didn't see each other face to face, so we just see them online by the lecture and also the workshop, online workshop. And this our upcoming international conferences that we will have online on October and also December. So if everyone would like to join, please, and also can distribute to students so we can have this strong collaboration as because QS and THA we believe they can count it as an activity for outbound or inbound program activities. Last but not least, so this COVID is a multidimensional crisis that affect community, including higher education. Things change significantly and unpredictable. However, we are a lifelong learner, pharmacists. We need to respond it in a positive way. And we appreciate the development of e-learning in the world, not only in Erlangga. And that's all the way to create the new way of partnership. And this wide opportunity to speed up the research related vaccine for COVID or new drug for COVID. And we believe the true pharmacists, even though we do it online, we'll never be able to be replaced with that machine or that online system, with or without COVID. That's all. Thank you.
Dr. Dewi Melani, very wonderful presentations. And then I believe we all agree to one point that we have come to realize that there is only one known. That is, we cannot precisely know what will happen. That's also the essence of Dr. Fazren's presentation as well. So we will proceed to our discussions, and please, I'd like to remind all the audience again, you can raise your questions via chat box either in your Zoom or YouTube control panel, and please pay attention to the format, and then you can also ask your questions in Bahasa Indonesia and I will have it translated. Thank you very much, Dr. Hasan, Dr. Deimani. There is questions from the audience about the productivity during the COVID crisis. We already talked about the students' responsibility. What about the teachers' responsibility? Do you have any like key performance indicator that is modified to what is called to anticipate the progress or the productivity of work during these pandemic situations? Perhaps Dr. President or Dr. Devi, please.
Okay. For in Malaysia, Faculty of Pharmacy, even though we are facing the COVID-19 pandemic, but actually our KPIs remain the same. We still need as we are still expected to publish
Yes.
3 publication in WOS per year per lecturer. So we're working on it actually. So of course, in the first phase of the pandemic, I mean, most of us are working from home and the laboratory is shut down. We cannot do any research works. So what our strategy to ensure that we still meet the KPI is that we all do a review papers. So whenever you don't have the resources to go to the lab and to do research works, so we're having this to change our publication towards to a more review-based publication. So that's what I'm doing with my students. So I asked them to write a literature review that aiming to be publishable. So that's one of our strategies. And but now we are quite lucky. Start of the June, our postgraduate students can already now entering the lab and do their research work. So the research activities are now resumed as usual in Faculty of Pharmacy. And of course, there are strict deadlines where they need to practice social distancing, and we take notes on the maximum capacity of the lab that the students can enter. So they have a list, schedule list, like they need to take turns for them to do their research works. So we want to ensure that we always comply and practice with social distancing.
Yes, interesting. Though, despite the COVID situations or the pandemic situations, the KPI hasn't changed at all, and then there is no like relaxation or like some modifications to the KPI. Is it also applicable or happens in UNER as well, Devi?
Yes, Dr. Andy. So also same with the Dr. Fazren, our KPA also has not changed. Yeah, even though we keep, the faculty asked the rector to reduce the KPI or to adjust it, but they say we can try until this the end of this semester. And if it does not work, then we will try to adjust the KPI. So hopefully in the last 3 months, so maybe next month, after the new dean selection, maybe the rector will adjust the KPI. But until now, still same. So we try hard to get that KPI done. So we try to save from the publication by lab research to the review, and also for student inbound, outbound, we try to send them or to accept student from overseas by online. So we try to promote students by international virtual seminar or webinar. And next month on December, we will send about 17 lecturers to be oral or poster presenter in the international seminar. So that can be count as the staff outbound. So something like that. Yeah.
Interesting. So,
Just
so
finger crossed.
demand for all the works is not changed at all, despite the pandemic situations. And then there is a question from Tias to Dr. Basran. We understand that the higher semester or higher students might be what is called might be familiar with the online situations as they have a previous experience with the online learning. What about, but we don't know exactly the impact of this online learning, particularly for the new students, those are in the first semester. Do you have any instrument or measurements to evaluate the effective learning to this new or novice student?
And whenever we implement new things, we always make a research. We always try to compile the research data, even at particular pharmacy, to see the effectiveness. Like for example, we have two different group that we study at the moment to see the effectiveness and the efficacy when we switch things online. And the data is not out yet. We're still, about to implement the study and survey and to see the effectiveness. Are they comparable when we do have face-to-face lectures or via online platform? But believe me, most of the students now, they are the new generations where they are quite high-tech. Even before the pandemic, we were all being encouraged to utilize all the online platform. For example, like Kahoot, to incorporate some new technology advancements in a teaching material. It's no longer like a new conventional method of delivering lecture, like giving a PowerPoint. We now have a flip learning where we have our UKM folio. We can have a video and we can have a discussion. And then we can also divide sometimes. For example, for my lecture, I also divide the students. For example, I have pharmaceutical technology lecture on the vaccines, for example. So I divide the student into a group. For example, they are the one who be the lecture present. And of course, we still need to be there and to guide. So my personal view is that these new generations, you prefer a more online engaging with a new innovation in the technology. They are quite different. For example, I'm not that old, of course, but during my time, it's still different compared to this new generation of students. Somehow they prefer this online. Based on when we had our survey at first, actually, yeah, they're quite happy by having the lecture via online platform. Of course, they have more freedom in terms of time and so on.
Yes, of course, the burden, in fact, in the shoulders of the lecturers.
Yes.
Because they have to adapt with this changing situation, while the millennials they already live with that. There's also a question on your screen. Perhaps you can see it on your screen that what is the example of policy that UKM has taken regarding the new students admissions? There any such, I believe it is about any relaxation or any, I don't know, whether any privileges for the new students to enroll or to be admitted at the UKM.
Okay, basically how to evaluate the virtual learning in UKM, especially for the first semester students. First semester means they are new students. Of course, whenever, like I mentioned earlier, we always have a rubric, for example, for each lecturer and each of the program that we course. So that's how we evaluate at the end of the day. We're having to gather all the student feedbacks. And all the lecturers will be given marks accordingly. There's a rubric for the student to fill in. And we need to pass at least 4.5 onwards out of 5. So to ensure that even though we deliver the stuff online, it needs to be in a good and efficient manner, and the students should be happy about that, and they should gain all the benefits similarly when we do the face-to-face lectures. So there is like a specific evaluation from the students on us actually in UK Faculty of Pharmacy. And similarly for the first semester students, so this motivate the lecturers to do well, even though they need to deliver all the research materials via online platform. So how do you guarantee the student can manage or cope it well? Of course, when we switch to the online platform, we do a survey form to the students, and for the students that mentioned in the survey that they have some difficulty in terms of internet connection, especially those in rural areas like in Sabah or Sarawak, we take that into account and we provide a platform in the University UKM actually, where we will gather them to be back on the campus, which we believe that the campus has a better internet connection for these students who have difficulty. For those who choose to return back to campus to have a good internet connection, we will ensure that they have the option to be back on campus. But for those who have a good internet connection, we encourage them to stay at home. But actually now, the policy now is that all of the students will return back to campus because we want to be sure that everyone has a fair and smooth internet connection, so that even though they're back in campus, we are still implementing a hybrid teaching module where we're still going online, but only the practical for the selective group or year that we ask them to be in the campus. But we are still implementing an online virtual platform.
Yes, that's inevitable. I mean, yeah, that's the condition at this moment because we cannot. I mean, we are relying on the internet connections as our means to communicate. There is question for Dr. Dewi Melani. How effective are the protocols or guidelines, particularly the health guidelines? I believe this was about the health guideline implemented in UNER so far, and how would you compare it with other developing countries?
Okay, thank you. So for the first question, it's a very difficult question because as we know, Indonesia cases increase. So we can't say that our protocols or guidelines is the most effective one. But I only can say for the Erlangga University. So we keep the health protocols strict from our supporting staff to lecturer and also students. So until now, we didn't allow for bachelor students come to our campus in Faculty of Pharmacy. And we also only allow like about 25% of the supporting staff, especially people who cannot work by online. So they have to do their work offline. For example, the financial officer, and also some of the privacy document. I mean privacy document for the academics document, the important one, the confidentiality document. So they need to come. So the work that cannot be replaced by the online, so they can come to the campus with the health protocols, except the people with the age consideration above 50, 45 or 50, and then people with the high risk, and yeah, so only it seems like only young people comes to the campus. And started by this September, we allow only for postgrad students to come because we believe they are as a major one. And also we ask their rapid tests have to be clear from COVID, so then we can allow them. But still we limit the laboratory capacity. So it depends on the space, square, the room, laboratory space. So it's still about the maximum is 50%. So we really make this guideline strict, so in line with the government requirements as well as the Ministry of Health requirements. And yeah, compared to other developing countries, we don't know yet, but we hope we will we will have this better. Everything will get better and better. So then we can allow junior students, bachelor students to come and to start their lab work hopefully in November if the uh, national conditions didn't change. So yeah, that's
Yeah.
my answer for the first one. And for the second one, we cannot go abroad to start the collaboration strategy to try making new collaboration with other university or researcher. Yeah. Yes, we cannot go overseas. So we provide we make an interesting program, and still be like Indonesia is famous, for example, with the Indonesian traditional medicine. And then many people, I believe, hasn't come to Indonesia to see how about Indonesian botanical garden, for example. So we are here, we can make very good videos, and then we provide them as a pack of the program. So it kind like students exchange, so they can have a class about that traditional medicine or Indonesian specific famous program. And then yeah, we try to make interesting program. to attract the collaborator. And we send it through the website, the dissemination, and also we send to the, when we attend the online seminar or international webinar, then we can also share our brochure, and then we start to make a new peer list. And if we found a researcher in the same SDGs topic, for example, because we know that many universities also work with SDGs, because QS and THC now is, that's the main priorities, also one of the rank requirements. So we can foreign researcher. I think, yeah, still we have to have many positive ways how to
Yes.
create a new collaboration.
Yes, thank you very much for both speakers. One last question for both of you. We understand that this pandemic situation has significant impact on our pharmaceutical educations, both in Malaysia and also in Indonesia. While all teaching were forced to be distance, and you have a plan to reopen your campus soon, either in the end of this year or perhaps in the next year. Do you have these extraordinary situations have pushed us also to think about the possibility of conducting virtual classes after the pandemic situation? Do you have any idea about it? Do you have any comments about it? Do you still continue your distant learning, although your universities will be open soon, or you will be focusing only on your classical conventional classrooms? Dr. Pasel, Rafi?
All right. For UKM is we have quite a clear policy, means that when there's still uncertainty in these COVID-19 cases, we always need to take all the preventive steps as a measurement for our strategy in containing the spread of COVID-19. Until there is a vaccine made available, we will always encourage the lecturers and the students to go into a hybrid mode unless it's really necessary for them to attend, for example, certain practicals that cannot be done or not yet being conducted via virtual platform. So we always look at the hybrid mode at the moment. But for students with the postgraduate that are doing their lab-based research, yes, we are allowed. But of course, I believe the strict regulations would still be applied, even though after we are all back in business. But other
Yeah.
regulation, that's what they are saying now. It's a new norm, and I believe this new
Yes.
norm will continuously ongoing until we are completely sure that we have contained the COVID-19 virus.
So in other sense, you say that the hybrid learning might be the best possible options for the new normal, particularly for next year. Yeah.
Yes, for the new normal, it's hybrid.
Thank you very much. What about you, Dr. Devi?
Same. I think the next 1 year, I think we still keep doing this online and virtual things, because that's for the safety for everyone.
Yes, indeed. Thank you very much then. Yes, again, the sustainability of pharmacy education is really depending on the situations, and then we absolutely agree that we have to work together, collaboratively to prepare pharmacy students to be practice ready and also team ready for now on, and also for the next, if there is any global pandemic, because this is also an uncertain situation and also unforeseeable situations. Thank you very much for Dr. Fazren. It was wonderful presentation and wonderful discussion to have. And also Dr. Devi Milani, thank you very much for your contributions to this webinar. Like other previous speakers, I would like to convey our message. Thank you message from the Dean of the Faculty to Dr. Fazren Asmi. Thank you very much. And also we will pass our gratitude to Dr. Devi Milani for your amazing contribution to this webinar. Thank you very much.
Thank you.
Now, final reminder to those of you wishing to obtain an AC certificate, please complete the requirements as displayed on the screen. You need to fill out the attendance list, also attend the webinar sessions, and also fill out the posters link at the following link posted in your screen. Next. This is the link for the posters. The posters and evaluation will still be available until 5 p.m. And then please make sure you have filled all your identity properly, as we will send your certificate based on your identity informations. And you only have one chance to access the posters links. Therefore, please remind yourself that identity information is very critical for this posters. So the celebration for the 15th anniversary will still continue with a number of webinars on the line. We will meet again this Thursday with another webinar about the strategi manajemen farmasi dan pelayanan apoteker di komunitas pasca pandemi COVID-19. Thank you very much to all audience, to all speakers, and we still have another webinar to go, and also the national seminar. We will have this seminar and the call for paper on Saturday, 26th of September in 2020. Don't forget to submit and register, because tomorrow is the last day for the registration as well. And then we will meet again for this national seminar, another webinar. Come. Next. Okay. Thank you very much, and thank you for staying with us for the past 3 hours. I hope you all enjoy this webinar. Keep safe, keep healthy, and keep motivated during this crisis. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you.
Thank you. Thank you,
Thank you
Dr.
very much.
Fazril. Thank you.
Congratulations on a